academic excellence shines through innovation and a personalized educational experience. From pre-K 3 through 12th grade, our school encompasses a family-oriented atmosphere. Our faith-based value system works as a foundation for supporting our honor code, while our academic standards prepare our students for college and beyond. I'm Patrick Uran, headmaster, inviting you to join us for our virtual admissions open house on Thursday, January 28th at 9 a.m. Register today at oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
Good morning. Time right now is 8:30 today, Wednesday, the 6th day of January 2021. I'm your host this morning, Colin Worthington. Very important guest and special guest with us this morning. I'll introduce you to here in just a second. Infectious disease specialist with Tanner Health System and Carroll County Board of Health Chairperson, Dr. Laura Larson, our guest on this morning's program. We're going to talk about several things. Dr. Larson, good morning.
Good morning.
And appreciate you joining us. Love to check in with you about once a month as we can, and sometimes even more as we check out what's happening with COVID and the hospital system itself. We are on the News Talk 1330 Facebook page this morning if you want to post your questions and comments there this morning as well, and I'll try and take a look at those whenever we do get the opportunity. Well, let's start off with the capacity of ICU at Tanner. We'll talk about the vaccine and this potential new strain in Georgia as well. But as far as capacity in Tanner right now at the ICU, what does that look like?
Well, we have about half of our ICU beds are filled with COVID patients right now. So we are not at capacity for COVID. We're very, very busy in the hospital with COVID, though. We hit our top number of inpatients with COVID 2 days ago. We had 87 patients in the hospital with COVID, and that's about half of our beds. So that's a lot. So, you know, for anyone who's thinking it's on the decline or it's over, we're higher than we've been for hospitalized patients. We're higher of positive patients. You know, everybody reads about that percentage in the media, and you know, there are some places, unfortunately, they're experiencing a percentage of tests positive of about 30%. And we're about right around 19% of our people that are being tested are positive, and that's our highest percentage for Carroll County and for our hospital system since this all started.
And you did say it's the highest number using the beds right now, but can we compare that to the flu season of last year? How does that compare?
It just doesn't. We haven't had half of our hospitals full of flu patients, and I've told a lot of people that compare this to flu. We use the same definition to compare flu patients, flu-related deaths with COVID-related deaths, and our worst flu season for flu-related deaths in the last 15 years I've been here was 7 flu-related deaths, and we're getting close to 200 COVID-related deaths using the same definition. So
we talk about the capacity being used at this point. Is that what really should be stressed here when people roll their eyes at the the fatality rate compared to maybe the fatality rate of flu or anything else every year? Is this the biggest concern, just overwhelming the hospital and the health workers?
Yes, and I think the healthcare workers are very tired. I know I'm tired. I want this to be over just because there's a new challenge every day. And it's just this. In the beginning, this felt like, Groundhog Day all over again, and it still does. I'm a little numb to that feeling again. But I think that healthcare workers are very tired. And we had our vaccine come in the right before Christmas on December 22nd, and that was a very hopeful day. And it was the emotion and the happiness that we're here. It was really gratifying. I mean, a lot of people are talking about it being a Christmas miracle. I mean, I know that sounds kind of corny, but it really did. It kind of was a beacon for us that maybe this will be over in the next year. That's what we're all hoping for.
The next year. The Tanner workers healthcare workers were offered the vaccine. I want to say about 2 weeks ago, and according to Tanner officials, it was 1,000 health workers or just employees, staff at the hospital accepted it. But I'm guessing that wasn't every employee. Why are some not taking it?
I think people are fearful of the unknown. I think people are fearful of how seemingly quick this vaccine made it to market. And I think some people are actually just not getting it because they've recently had COVID. And we're, following CDC guidance, which says that, you don't have to hold off 90 days, but it's very uncommon to get COVID again in the first 90 days of infection. And so to allow other people to get vaccine, the recommendation is there for considering waiting 90 days after infection to get vaccinated. I know that that's happened a lot with some employees that have recently had COVID. And then we're still vaccinating people. There have been some people that wanted to wait to see what other people, make sure other people didn't have reactions and that type of thing. So some people are just waiting to see, that are cautious. We've had some people that have been pregnant and breastfeeding that wanted to wait. So there's a multitude of reasons. But it's right now, it was 1,000. I just looked at the situation report from yesterday. It was 1,400 that have received vaccines. So we're still moving. We've only had it for a couple weeks, so that's pretty good numbers to me.
Hey, explain how these vaccines work. There's two of them right now. How do they work? Are they working the same way?
Yes, they do. They're both mRNA vaccines. That's messenger RNA. So it's a little piece of a blueprint that's coated in lipids or fats, so it gets into cells easier. So it's injected into the arm, and the cells take it up, and it's the cells right there take it up. This messenger mRNA doesn't go all over the body. It's read by those cells, and it's read to make a particular protein called the spike protein of the virus. And then that messenger RNA, our body's really good at cleaning up things that, once they're used to it and are done with it, and the body cleans that up so it's not something that lingers. But then the cells that picked up that little blueprint and made that protein put it on their surface, and the other cells recognize that as foreign, so they make antibodies to that protein. So that's how mRNA vaccines work, and they're very, very efficient, and their safety profiles are very, very good compared with a lot of vaccines. So that's how they work. And so the initial shot is called essentially a primer, and the shot that occurs either in 3 weeks for the Pfizer vaccine or 4 weeks for the Mrna vaccine is the booster. So that's how they work.
Was there a drawback to not getting that second dose of something, say you're out of town or something like that, if you have a concern and you decide not to get that second dose? What's the drawback for that? So
the efficacy of the vaccine after the first dose is 70%, and the efficacy of the vaccine after the second dose is 95%. So that's the difference. And so you're more likely to have protection after getting the second shot. But 70% is not a bad number at all to have some immunity to getting COVID. And so, if you look at flu vaccines, it's all over the map. Sometimes they're 40% effective. Sometimes a good flu vaccine is about 75% effective. So, having the first COVID vaccine being 70% effective is a good number when it comes to vaccines.
Is one of these vaccines better than the other?
No, not that we know of. The efficacy data is very, very similar. The safety data is also very, very similar. I would take either, and so I have no recommendation of one over the other.
What are the biggest challenges that health officials are facing in getting the vaccine out?
Yes, absolutely.
But what are the biggest challenges? Is it getting a bunch of people in the same room, considering that we're all trying to social distance? What are the biggest issues, biggest concerns as far as getting this vaccine out?
Yeah, so the Pfizer vaccine has to be ultra cold storage, so that's one problem because you have to thaw it out. It takes 30 minutes to thaw out. Then you have to dilute it and then draw it up. The Mrna also has to be in cold storage, and then you have to draw those up as well. So the Pfizer vaccine has 5 or 6 doses per vial. The Mrna, I haven't done those yet in terms of working with those specifically, so I don't know for sure how many are in each vial. So it's one of those things that once they're drawn, you have to use them within 6 hours. Otherwise, they're not considered effective anymore because that mRNA is very, very fragile. So that is something that is a hindrance because you don't want to waste vaccine, that's for sure. And then so having the right number of people, and you also have to have it in an environment where you could treat a severe adverse reaction. Fortunately, we haven't seen any severe reactions, which those we consider anaphylaxis, but we have anaphylaxis kits available to treat that should it occur. And, anaphylaxis is, essentially it's a very severe reaction that can happen to a lot of different things, but you have to address it immediately because a person can die of anaphylaxis.
Are we able to access these about the speed that you had hoped, at the rate you had hoped? Should they have been distributed sooner, perhaps?
I wish they had been sooner. I've just learned during this whole pandemic that, when we wanted everything yesterday and it didn't happen. So I've kind of learned to be patient and know that that's the way that this has happened for this pandemic. It's very hard. I think logistically it was very hard to distribute vaccines like we have on such a massive scale. So yeah, I wish we had done it sooner. I don't work with the people that are on the upper level of distribution for the federal government or the state, so I don't know how it could have been done any differently.
As the chairperson of the Carroll County Board of Health, do you believe that vaccinations should be mandatory for any group, or school students, elderly?
I don't. And the reason for that is a couple of things. Number one, you can't mandate therapy that is under emergency use authorization. So this is not FDA approved yet. It's emergency use authorized. So to mandate something that hasn't gone through FDA approval yet, I think is just ethically wrong. And I think that it's one of those things that we have a lot of data coming in. You have over 2 million Americans that have gotten vaccine with, some serious reactions, but for the most part, very well tolerated. I just think that right now it is not something that should be mandated yet. Maybe in the future, I don't know. But no, I don't think it should be yet.
Well, what if only 50% of any given community gets the vaccine? What difference will that make as far as slowing the spread? Or any number.
You got to consider that part of that community will also have had COVID. So I think that 50% is certainly not a terrible number. In fact, I think it's a really good number for vaccination, because without any vaccination, we're running at maybe 10 to 20% of the community having, for our numbers now, 20% of the community having COVID. We haven't done any seropositivity studies, which means, you draw a bunch of antibodies on people to see how many people actually have COVID here. So we don't know. But, if you look at the state seropositivity, we're nowhere near herd immunity. So having half of the community vaccinated I think that would be fantastic, and I would just be elated if it was even higher than that.
Time right now is 8:42. Our guest this morning, infectious disease specialist with Tanner Health System and Carroll County Board of Health Chairperson, Dr. Laura Larson. We're going to take our first break and continue our conversation with her this morning. Community Voice brought to you by Tanner Health System, Oak Mountain Academy.
At Oak Mountain Academy, we are a family creating legacies. The Fortner family shares. OMA has assisted us in providing our 3 children with a solid educational foundation and a love of learning. The Academy has done so with an emphasis on building a strong inner character. We would love to share more with you about our school community and how you can become a part of this legacy. I'm Patrick Urian, headmaster, inviting you to join us for our virtual admissions open house on Thursday, January 28th at 9 a.m. Register today at oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
All right, 8:43. Welcome back to the WLBB Community Voice program here on News Talk 1330, FM 106.3, streaming live online at newstalk1330.com. And this morning we're on the News Talk 1330 WLBB Facebook page. Appreciate you tuning in and your comments and questions. I'll look at those in just a second. Our guest, infectious disease specialist with Tanner Health System and Carroll County Board of Health Chairperson, Dr. Laura Larson. Did want to talk about, there are some questions here relating to my next statement, so I'll follow up with those. Georgia Department of Public Health on Tuesday announced that Georgia's first case of COVID-19 variant B117, which is the same variant discovered in the UK and several other countries in the U.S., they discovered that in the state of Georgia. They did not clarify what district it's in or what county or anything like that, but they said the resident is an 18-year-old male with no travel history and is currently in isolation at home. What do we know about the variant, the mutation?
I suspect that variant is a lot more in the community than we're aware. It's just hard to look for and it's hard to find. What I can tell you about it is that it seems to spread more easily, and that we think that the vaccine is effective for it. It's just almost too early to know. It's something that it's a little bit more easily spread variant. That's really all we know right now about it.
But when it's more easily spread, in theory, is it just lodging itself in closer, I guess, in our mouths more than it is going into our lungs? I mean, why is it more easier to spread?
It really, we don't know that. A lot of times the reason vaccine or viruses may be easier to spread is either you have a higher viral load of it, you just have more virus when you carry, or just that it can enter the body easier. So that's really, we don't know the mechanism of why this one is more infectious, but I'm sure we'll know that over the next couple of months.
Let's see here. Brenda Hammock, any idea when the community will start seeing the medication available in local pharmacies?
You mean medication or vaccination?
Well, it says medication, so I'm going to assume it's vaccination.
So I know that's coming. I was on a public health call yesterday, and we know that CVS and Walgreens will be getting vaccine. I suspect that that's going to happen really fast. We know that the Department of Public Health is going to start the mass vaccination site, we hear, tentatively next Tuesday in Carroll County, and that'll be an ongoing plan. Initially, I think the first day it's going to be open all day because Governor Kemp and Kathleen Toomey have included people over the age of 65 to be vaccinated starting next week in the state of Georgia. So I know that is starting next Tuesday, and it'll be ongoing on Tuesday mornings in Carroll County from what I understand. I have been told that the way to enroll in that is to go to the Georgia Department of Public Health District 4 website, and that's for Carroll County residents and any county in District 4, and to sign up online. That is not live yet. That's just tentative. If you live in Haralson County, you call District 11, and they will direct you. Their mass vaccination site, I understand, is going to be the Braves Stadium in Rome. There will be more and more information ongoing. I think we're going to start opening up and seeing a lot of avenues for vaccination going forward.
How long does it take to see any benefit to the initial vaccine?
So the initial vaccine, you should have some detectable antibody in 2 to 3 weeks. And I can tell you, I participated in a vaccine trial in September, so I can tell you more about how I think that they do things, because I enrolled in the Mrna trial in September and received vaccine on September 1st. And when I came back on September 29th, I got blood drawn and I got tested for COVID every time I go. So they look for detectable antibody at that second visit. So that data will be coming out on how many people have detectable antibody on that second visit. But the real benefit, essentially the 95% efficacy, they believe is 1 week after the second vaccine. That is something that's pretty, that's what we know. And I'm willing to answer any questions you might have about being in that clinical trial. That was pretty exciting. I found out last week I actually got the real vaccine. So that was very reassuring and relieving.
Well, yeah, tell us about that trial then, if you don't mind. How many groups, I guess, where did it originate?
So there were different groups all over the United States that enrolled people. There were 30,000 participants enrolled in phase 3. And that's the reason why this vaccine came out so fast, is that we did phase 1 and phase 2 at the same time. And phase 1 is essentially you're trying to determine the dose. Phase 2 is safety and efficacy, or safety. And phase 3 is the efficacy trial. So usually when we do clinical trials, we don't enroll 30,000 people in the last phase. And so that's why we were able to get efficacy data within months rather than years, because normally it's a much smaller group. So I signed up online. They called me to come in. My first visit, I was there 3.5 hours. I got blood drawn. I got tested for COVID in my nose. I got a physical exam, signed consents, and then I got a vaccine versus saline in my arm, and I wasn't told which one I got. And so then I had to do a little diary online, and then I got called weekly for symptoms and whether or not I had COVID. And if I developed any COVID symptoms, I had to go there to be tested. So I didn't. And then I went back for the second visit on September 29th. It was a little bit shorter. Got the second shot versus placebo. And then I've been doing that online diary for a week, and then weekly online diaries, and I get a call once a month. And I'm going to be followed for 25 months. They do blood draws about every 6 months to see if I still have detectable antibody, and they see if I get COVID over the next 25 months. So I really didn't think I got it because my reaction was super mild. I was, I was so relieved last week when I found out that I really did get it. So it was a very mild vaccination for me.
Everyone who took that test, are they a healthcare worker or a physician?
No, they had all groups. They had different racial diversity, age, all different ages. They had a lot of healthcare workers because they knew we were a very highly exposed group. But they chose a lot, just a wide variety of people. And there's still some clinical trials ongoing for other vaccines. The Novavax vaccine is underway now, and they are looking for more racially diverse people for that vaccine, people of color, because they want to really, study that group more so because that's the group that is hit hardest by vaccine or by COVID.
All right, time right now is 8:50. Our guest is infectious disease specialist with Tanner Health System and Carroll County Board of Health Chairperson, Dr. Laura Larson. Before I do take my final break here, I want to go to the Facebook page and pass along some questions from our viewers and listeners. Angie Edwards Esparza asks, if you contract COVID after you do get that first vaccine, we did say that it could take 2 to 3 weeks to take effect. Should you get that second? And if so,
Yeah. So what we're doing we've had that happen, because we have the highest numbers of COVID in the community right now, and we had several employees that got vaccine and got COVID that first week because they weren't protected by the vaccine yet. So what we're doing is we're asking them to wait 30 days after their illness to get the second vaccine. And if their illness was really mild, we may even want to wait or really severe, we want to wait longer. We are seeing people that had severe COVID have a stronger reaction to the vaccine. And I want to stress that because it is normal in over half of the cases to have a sore arm, to have fever, to have nausea, to have some symptoms like that, especially if you've had COVID before. So while I had almost no symptoms with the vaccination, if I had had COVID previously and already had some, immunity in my body, seen it before, I may have a stronger reaction to the vaccine. So I just want to stress that.
All right. Sean Paul is asking, is remdesivir being prescribed regularly to help patients avoid hospitalization?
Oh, yes, very much so. We know that remdesivir works very, very well if you get people early that are not yet severely hypoxemic or requiring a lot of oxygen. So we are regularly prescribing remdesivir and dexamethasone in patients that get admitted with COVID. And we're also using the bamlanivimab, the monoclonal antibody, for outpatients that are at high risk to progress to severe COVID.
All right, time right now is 8:52. I need to take our final break here. We'll come back and wrap up our conversation with infectious disease specialist with Tanner Health System and the Carroll County Board of Health Chairperson, Dr. Laura Larson, after we hear from our sponsors, Community Voice, brought to you by Tanner Health System and Oak Mountain Academy here on News Talk 1330 FM 106.3.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. From pre-K 3 through 12th grade, our school encompasses a family-oriented atmosphere. Our faith-based value system works as a foundation for supporting our honor code, while our academic standards prepare our students for college and beyond. I'm Patrick Uran, headmaster, inviting you to join us for our virtual admissions open house on Thursday, January 28th at 9 a.m. Register today at oakmountain.us.
It is now 8:54. Welcome back to the WLBB Community Voice program here on News Talk 1330, FM 106.3. This morning, we're on the News Talk 1330 WLBB Facebook page. Appreciate your comments and your posts there this morning. I do have one more on there that I want to share with the doctor here, infectious disease specialist with Tanner Health System and Carroll County Board of Health Chairperson, Dr. Laura Larson. Dr. Larson, this one coming from Tony Williams. I believe we discussed one half of her question already, but do we have evidence that a person can be infected with COVID twice, and when it will be open for high-risk populations under 60 for vaccinations?
So, yes, we have evidence that a person can be infected with COVID twice. I just reported my fifth one for our hospital system to CDC yesterday. So I know of 5 people who have been reinfected. And the youngest was 41, and the oldest was 73. So it's really, and people ask me, is the infection worse the second time, better the second time? For all 5 of these patients, the infection has been about the same. So yes, you can get it again. We're, working with the CDC to try to save these specimens so they're able to study them and try to figure out why it happens again. I'm just, probably the real answer is this, that people just don't get full immunity. We know that. You have to get if you have mild disease in the beginning, you may not have enough immunity from a mild infection to get fully protected. So for the numbers of under 65 with chronic health conditions, I don't know. And that's been very frustrating because we just get guidance from the state when those groups open up. So it opened up to people over 65 way sooner than I thought it was going to. So I'm hoping the same is true for under 65 with qualifying medical conditions. I suspect at the speed that we're opening up vaccine administration that maybe mid-January, we're already almost to mid-January, maybe late January, early February, but it's just speculation. We literally get told when we get told what groups are opening up.
You'd mentioned the symptoms were about the same for the 5 people that you're aware of who caught it twice. Were the symptoms extreme the first time, or were they just more mild symptoms both times?
These were all hospitalized patients. So they were severe enough to be hospitalized for all 5. It would be very hard for us to capture people that were reinfected that are out in the community. We don't have a good way of doing that because we don't test everyone in the community. So I suspect there's more than 5, but for these people, they were severe enough to be in the hospital.
All this year, we talked about the concern for the flu coming in. Worried about these two viruses coming out at the same time. But it appears that the flu has been a significant drop compared to last year as far as hospitalizations and maybe positive tests. Why is that?
I think we're doing a good job with masking, better than we do outside of flu season. But the other thing too is flu season hasn't peaked yet. We peak in February, almost all year. So. It's one of those things that even some masking is better than nothing, particularly for flu. And we've seen that in countries that are much better with mask wearing, like in Asia, where it's much more common for people to wear masks, that it actually helps with flu season, too. And it appears, too, that flu is just not quite as contagious as COVID, because people ask me, well, if masks work for flu, why don't they work for COVID in every case? We just are dealing with a different virus here.
And there is speculation out there, and I'm sure you've seen it on Facebook, and people talk to you, that colds and flu are all just being lumped into with the COVID numbers. What are you telling these people? And I guess what's the convincer that these are being separated properly, documented in the right way?
Well, we're only counting our COVID numbers on people that test positive for COVID. There is a surveillance system done by the CDC called the influenza-like illness, which is just a temperature over 101.5 and cough or headache. And that is a definition that has been used previously to surveil for flu. We do not use that definition in our COVID reporting. We only report cases that actually physically test positive.
Dr. Laura Larson, our guest on this Community Voice program. We're about to wrap up the show. Got about a minute left. I mean, what can you remind us about our healthcare workers, about what they're going through right now?
Just keep supporting us. Please, if you can, and continue to wear your mask. We are hopefully on the tipping point of this, mountain, and we'll be going downhill and away from COVID as much as we can. So please continue to mask and socially distance, get a vaccine, and let's just put this behind us.
Well, we always appreciate talking to you, Dr. Larson. Thank you for joining us this morning, and I suspect hopefully we'll be able to talk to you and have some better news next month if we get a chance to bring you back on the show.
That sounds great. Thank you.
Thank you. And thank you for listening to this morning's Community Voice program here on News Talk 1330, FM 106.3. And, of course, it's on the News Talk 1330 WLBB Facebook page. If you have additional questions or comments, perhaps you can feel free to post those up on Facebook. And Tanner Health officials might get to look at that later on in the morning because they do share this program on their own Facebook. Time right now is 8:59. Stay tuned for national headlines, followed by local news. And then Glenn Beck is on the air here on News Talk 1330, FM 106.3. Have a great Wednesday.